23-year-old homeless man who is brought to emergency department because police found him lying in the park. He is confused and has slurred speech. His pupils are normal and reactive to light. There's a small laceration on posterior skull. Some dextrose, thymine, and naloxone is given. The scalp laceration is sutured. Blood and urine sample are collected. Blood alcohol level is 200 milligram per deciliter. AST is 320. ALT is 150. Gamma glutamyl transferase is increased. Which of the following would be another finding in this man's examination? Ataxia, pinpoint pupil, vertical nystagmus, high blood pressure, or increased appetite. Okay, so this is a patient who was found unconscious in some park, and he had slurred speech, and then there was rise in alcohol in his body, and he was given dextrose, thymine, and naloxone. This is an important point to remember. Naloxone is used for treatment of opioid poisoning, and dextrose and thymine are used for treatment of alcohol poisoning. Usually, when you do not know for sure what it is, because blood tests take time and you have to treat the patient very early, very quickly, because this is a patient who is unconscious, you don't know what is going on with him. So usually both opioid and alcohol poisoning are treated together at the first instance when you think that either one of them can be there. So actually opioid poisoning, acute opioid poisoning, many times can present very similar to alcohol poisoning, that the patient will have slurred speech or things like that. And the hallmark of opioid poisoning, that is pinpoint pupil, can sometimes be absent. So that is why, like, you do not take a risk. You simultaneously start treating both opioid and alcohol poisoning, and once the test is there, you can stop the treatment of opioid poisoning. So this is kind of, let's say, step 2-ish question, but okay. Okay, an important indication that they have given is AST and ALT. Here, if you see, AST is 320, ALT is 150. So AST to ALT ratio is greater than 2, which is hallmark of alcohol poisoning. So that is why, like, often when I take guest lectures, I tell that you use questions as learning tool. So once you see this question, you will never forget that AST to ALT greater than 2 is alcohol poisoning. If you kind of read this question very keenly. So use questions as learning tool. And GGT is read. Which of the following will be found? So this is ataxic gait. Pinpoint pupils, I told you, is found in opioid poisoning, but since blood tests are done and you have found all these findings, opioid poisoning is ruled out. When do you find a vertical nystagmus? Vertical nystagmus is found in PCP poisoning. PCP poisoning, if you guys have read through that poisoning part of first aid, it seems, at least for me, it seemed very confusing. But as I solved the question, I realized there are very few important stuff that you need to know about each poisoning. So PCP poisoning, for PCP poisoning, you should remember only 2 things. PCP poisoning causes very high amount of aggressiveness. Patient becomes very aggressive, and vertical nystagmus. These 2 things are like hallmark of PCP poisoning. So with respect to that drugs and poisoning chapter given in first aid, you need to know very few facts. So try to just focus on them. High blood pressure is cocaine. Increased appetite is marijuana. So just try to remember.
Thanks for watching. Please give a thumbs up and subscribe for more.